Good evening, Bula Vinaka and Namaste. Welcome to Fiji Village Straight Talk. I'm Vijay Narayan, and as we always say, we will continue to push for issues of concern to our nation. You, the people of the country, what affects you will be on this show, and we'll get the people who can make a difference in these critical issues in our country to take issues forward. Tonight, this is a very important issue for almost half of the population, first of all, because they are affected by this at a certain stage of their life, and it affects the whole family. It affects them as a citizen of this country. Unfortunately, it is not being talked about. Unfortunately, not enough budget support has been given for many years by the governments that have been in power. Unfortunately, our women have suffered, our mothers, our grandmothers, our wives, our sisters, as they turn into mid-40s and going on to about 10 to 15 years from there onwards, they go through a phase called menopause. And there's 3 stages of that phase, and sometimes they go through all of this without sharing with anyone about the difficulties they've faced. So if you are watching this show tonight and you have menopause, we would like to try our very best to expose the issue, to bring it to light, so that our nation, our leaders, our decision makers, and everyone who can make a difference can look into this issue with utmost urgency. I'd like to thank Nalini Singh, the Executive Director of Fiji Women's Rights Movement, and also Dr. Rachel Pillay, the Ministry of Health, Head of Family Health, for coming in this evening for the show. Thank you very much.
Thank you. Thanks, Vijay.
So we've talked about the report also released last week about the M word and what needs to be done. We will speak about perimenopause, menopause, and post-menopause. And as I've said, menopause is something that affects all women for almost 10 to 15 years of their life, from about when they're in their mid-40s to when they're about 60 years old. For some, the symptoms may not be as severe as the others. Some of the reports that I've read, 75% of the women will have some sort of symptoms, and maybe 25% of them may have more symptoms and very severe symptoms. So I'll start off with Dr. Rachel. What is menopause?
Thanks, Vijay. I mean, you've actually raised a very pertinent question and a very pertinent issue for women's health in Fiji as a whole. And when you look at it, firstly, it's actually a life cycle. It's a normal process that every woman may go through. Some experience it from different extremes. Some may experience it to a milder level. Some have, like you mentioned, have the extremes. So menopause is basically a period of time when a woman faces this period where their menstrual cycles, which is the periods, they stop basically. And it varies within age. It can happen usually in the around 45 to 55 years of age. Women can face this issue. It's not an issue, sorry. It can face this process in life. And that in itself can vary for individuals. For instance, some girls start early with their menstruation cycle, thus they may finish late. So, it really varies. And I must say, it's not one size fits all. One thing doesn't happen to all. So in this context, when we talk about menopause, we have to be pretty careful because it can happen early, it can happen later. So, but menopause is a period when it comes to a place where women have that cessation, the menstrual cycle basically stops. And when that happens, basically, a lot of changes happens in the body. I mean, one of the main things is basically our body is made up of hormones, of proteins, etc. And these hormonal changes bring about a lot of changes, which I believe we'll talk about a lot more later on. But basically, this is menopause, and we've got it in 3 phases, where there's perimenopause, menopause, and post-menopause. And it's that period within, for instance, like an individual for almost 12 months, their period almost is coming to an end. And within that period, it literally varies on how women present.
Nalini, FWRM just released a report titled The M Word, Ending the Silence, Fijian Women's Perceptions and Experiences Journey to and During Menopause. From your point of view, from a layman's terms, what do you think is the understanding of menopause out there on the ground?
Yes, so that's actually a very good question. There is a very little understanding of what is menopause. As Dr. Rachel was saying, women, all women go through this in various degrees and forms, and most women suffer in silence. So you see, in our society, we don't talk about our reproductive health. We don't talk about our sexual health. And menstruation and menopause as part of the life cycle, in terms of reproductive health, it just gets hidden. It's considered dirty, it's considered impure, and something that shouldn't be talked about. And because of that approach and attitude, women, don't come out in the open and talk about this. But in some, circles, there are some chit-chat in peer groups, but that doesn't mean that there's support and management, pathways. And of course, overall in society, there's a complete silence, a taboo around discussing this. Even though the onset of menstruation, the first menstruation, is celebrated in many of our, communities. After that, there's no talk about it. There's complete silence, and whilst issues like menopause we don't talk about anything else related to that too. So that is the situation we have in our communities and in our societies, and women are such that we will suffer in silence. We will suffer in silence. We will try our best to continue doing the work that we are doing, as if everything is normal, until there comes a situation where it's really not manageable, and then we'll be called, you are sick. That's the way to describe this, that my wife is sick, or she's got not well, when this is not a sickness or an illness. It is a process that women go through. And being aware about what is happening in our bodies, the different ways in which perimenopause, menopause, and postmenopause manifests, being aware about it will, make pathways to accepting what is happening more open, and henceforth perhaps the causes of some of the things that we see as not knowing what is happening because of menopause might even stop. So, that's what our research is trying to do, is trying to blow the lid on this particular issue where there's complete silence. We might be talking about menstrual hygiene and management, but we don't talk about menopause, where, we could have severe symptoms like in perimenopause of really, a high volume of, discharge or blood, and it could be much more than normal periods, and we don't think twice about it, and we move ahead and continue life with whatever products. We don't have products, designed to, cater for what women go through when their periods are like waterfall. That's exactly what it's like. There's nothing out there. And everything that's linked to it. If you're not aware about what's happening, you're not looking at your diet, you're not looking at what's happening to your, your body, your bone density, all of that, and there could be really severe medical repercussions as well. So this silence around menopause, it needs to be broken. We need to be talking about it in an informed way, and we must be aware of women around us who would be suffering from this and may not be talking about it, but in their behavior, such as suddenly, in the middle of a very cool afternoon, they will be sweating, just to be a lot more supportive around it. Same goes to employers as well, to knowing that women go through this process, we have no control over it, but, either experience some of it or, most of it, and to make it a normal part of our life, and not something that needs to be hidden and stigmatized, and therefore women face discrimination. Vijay.
Dr. Rachel, why do you think there's been a lot of silence and hardly any real work going into this to assist the women?
Very valid question, Vijay, and won't deny it. There's something within the space of, because, when we look at the wellness context, one of the things that I must say that health or we usually end up on is diseases. And when you look at it, like for example, the Sustainable Development Goals at the global level don't recognize this normal process of health for women. And when you bring it down to regional, national, there's not as significant emphasis as something that needs to happen. So while that is, left out at that level, I think as national bodies, this is something we really need to pick up and run with, because it is a normal process. It's a normal process for any women and girl out there growing up. And this is something they'll face. And one of the things Vijay, that actually goes masked in this context is when women go through this phase of menopause, like whether it be peri-menopause or post, sometimes people don't realize that I'm going through this, that they're going through this. Why? Because they would associate it, overworked, fatigue, because of I'm overworked, I'm tired, I work at work and I work at home, I'm literally exhausted, I'm tired. But they don't realize that it could be because of the menopausal process. So having said that, there is, with health, one of the things that happen is we focus a lot on disease-based, but this is something that's been at the back of our mind. We need to build capacity, we need to build up policies, we need to build up structures in place to progress this work, because it is essential. And this is where one of our important policies and strategies come in, is the wellness concept. It's the womb to tomb concept, that if we're talking about women, it's not just about the ill health, it's not about the unwell, it's also about wellness as a whole. So this is one of the approach that the ministry has taken recently on the wellness context for a while, building our plans around it. So I think and now we're breaking the silence. Now we need to bring it to the table. We're definitely developing this space a lot more. And I'm glad we're talking now. And you can be rest assured that the ministry is working on this at the background. And we've, as a ministry, one of the things we've just done recently is we've endorsed a maternal child health policy in this space. And within that policy, we want to make sure that, encompassing menopause and women in this context is there. And this is already through existing structures that we've got. We want to make sure that women as a whole, when they take their child for immunization, there's been a lot of opportunities lost to provide that extra add-on service for our women and family as a whole, men as well. So this is an opportunity we want to leverage on and make sure that we ask the simple questions, and when we recognize, we respond to it and make the necessary referrals. We need to start somewhere. And these are opportunities we literally will be leveraging on in the coming days. And the report, I must say, it's come at a very timely manner. Just give you an example, gender-based violence was something that the health, while we responded, but it needed to be done right. And 2013, when that report came out, Somebody's Lives, Everybody's Business, that shook us all. And we made sure that every different line ministry was doing something in that space. And that's where now today, when we look back, we've got a GBV guidelines for health workers. We're doing a number of trainings across. And the same thing now follow with menopause as well. And now we anticipate to see traction and work in this space. But yeah.
We'll talk about gender-based violence because some of those cases are linked to menopause as well. But going to Nalini, why do you think there has been the silence and hardly any action to support our women with menopause?
Yes, I mean, one is, what society, what our faiths have determined, and there's very little done to encourage women to break out of that, in some of our faiths, menstruating women are looked at as impure and dirty, and there's a lot of what they can't do. And of course, the talk around it, there's no conversation around it. It's very hush-hush. You see that in the way in which, certain individuals or families prioritize or go purchase the products needed for menstrual management. It's considered as something that needs to be hidden and not out in the open. So we really do need to break out of that in our own families, at least, and that's where this conversation needs to start happening. Aside from that, we need to have this as part of our family life curriculum, and what we call in universal, acceptance, the comprehensive sexuality education curriculum. It's not a curriculum that talks about how to have sex. No, it talks about age-appropriate, information on how does a person understand certain concepts. So in primary school, children are taught about what does consent mean. If someone says no to you, how do you react to it? Do you react with it with violence, or do you, have another way of managing that no, or less than your expectation? Slightly older children should be taught what their body is about, and what happens as you grow, the functions, the changes that we experience. And with that, we shouldn't just be talking about the onset of menstruation and how that happens and how do you manage it. As Dr. Rachel said, it's a life cycle approach. We must talk about what happens at different stages. When we, women who become pregnant, what happens, to their body and to their reproductive, health and system. Moving on, as you approach 30s, now we are hearing that some women in their late 30s are experiencing perimenopause. So something is happening somewhere, and it's changing. So we must be taught this in a way, not to separate, the sexes and say only, girls need to know about this, but in a way where both, girls and boys begin to understand what happens to each other and have that kind of respect developed for if, their partners or family members are going through, difficult periods, or even menopause, then there is that care and support provided. So to me, it starts at home, and then it must be institutionalized in schools. And because almost all children go to school, and so that must be an avenue for education and learning and understanding in a way that is, done in a way that is acceptable. Universally acceptable curriculum. So it's high time we re-look at the entire curriculum and then see what needs to be brought in and talked about. And menopause needs to be discussed in the same breath as we talk about menstruation and menstruation management, because often those that have very, I would say painful experiences with menstruation get along to have worse experiences with menopause. I mean, it could vary absolutely, because it's all to do with hormones. And, and hormones for every individual reacts in different ways. And so once we break down the stigma and silence around it, we are open to talk about what's happening, in not ways to ridicule the person, but to provide support and care, and the love and affection. I'm sure that women would be more open to be discussing openly what is happening to them, working with the health system and other service providers to ask for services and be given that, because we need to talk about it to receive the services we need.
So basically breaking the silence here.
Well, we're breaking the silence. I mean,
Exactly.
and I've experienced this myself. Like my wife has been through this, and during the perimenopause period, the first phase, as she went into it, and some of the issues that she was facing, for example, she thought she was having a miscarriage. She thought, why is this happening? She thought that she was dying at one stage. And the scary part was that when she went to the medical professionals, not much help was provided. I just want to quickly highlight a book that has just come out by Mary Claire Haver, It's called the new menopause, and some it lists 66 symptoms. 66 symptoms, and I was just showing our people in the newsroom that read through these symptoms. Have you seen them that this will be part of maybe menopause? None of them have ever seen it, but it includes things like anxiety, arthritis, asthma, bloating, body odor, brain fog, brittle nails, chronic fatigue syndrome, crawling skin sensations all over the body, decreased desire for sex, dental problems, depression, difficulty concentrating, dizzy spells, dry or itchy eyes, dry mouth, dry skin, frozen shoulder, headaches, heart palpitations, high cholesterol, hot flashes. I'm not reading all, but I'm just trying to highlight, and the list goes on. Kidney stones, memory issues, mental health disorders, migraines, muscle aches, non-alcoholic fatty liver disease, sleep apnea, sleep disturbances, thinning hair on head, thinning skin, unwanted hair growth, weight gain, and many others. And they've said, according to this book, they continue to add on with the symptoms. My issue, and I want to say, I'm shocked that we still haven't been able to deal with this, let alone in Fiji, but the rest of the world is still coming out with. Why do you think that's the case?
I think it just goes back to focus, what our country is focusing on. And a lot of the agenda around health can be driven by obviously what's the main issues of the nation, as well as what the global issues are that we're trying to achieve, and regional context as well. So I think it could be that, but I could be wrong in saying that. But one of the things that literally drives a lot of our factors is disease. And when you look at it, it's part of the whole, like I said, it's a womb to tomb process. This is part of wellness. It's a whole concept across that woman's well-being. And it's just a transition. Why? Because the hormones are changing. And the hormonal levels are changing with the male-female hormones, the estrogen we've got in the body. And why this hasn't been focused globally, nationally, it's definitely something that we look at it from the wellness context, like I said. But I must say, it doesn't mean that there's nothing being done. There is things being done. There is recognition, but we need women to come forth as well. And now breaking the silence is allowing that to happen, where they come forth and say, Doc, I've been going through this. What do you think I'm going through? And I'm at this age, I'm missing my menses, I'm missing my periods, and I'm feeling fatigued, although I don't do much. I'm literally feeling weak, I'm tired for no reason. And these things, when women start recognizing, okay, that could be a bit of a problem associated with menopause, they probably come forward with it. And I must say, we need to take responsibility and take ownership of this and respond and educate our women and men equally, our population as a whole. And like Nalini said, we need to start this early, because this is one of the reasons when we start that education context, it changes the ball game in the sense there's a lot more better understanding in any relationship, and we respond appropriately or in a different manner. So yeah, there's a lot of reasons for that valid question that you've got, but like I mentioned, I think breaking the silence right now is very important and key to us as a nation moving forward.
What are your thoughts on the report, Nalini, that came out, also listed several symptoms that women were feeling, and many said they did not know what was happening to them. What are your thoughts on this?
Let me say, Vijay, on the outset, more than half the symptoms I'm experiencing, because I am menopausal. Induced menopause, because my perimenopause was, very, very severe. And when it was happening to me, I didn't know, I just thought, it's part of the process, and it's should be okay after a while. I didn't know that very prolonged heavy bleeding means anemia, severe anemia. And if I don't look after anemia, there's going to be other things, happening. What if I got an infection and, other complications, what kills you is not menopause directly, but interlinked issues, right? So what the issue here is that is what Dr. Rachel said. We look at individual issues, so you got aching bones, so we'll go and treat that. Oh, I see, you got thinning hair or a vision problem, watery eyes like what I have all the time now. We'll go fix that. But, it's not looked at in a holistic way. There's this thing, the approach to discussing sex, sexuality, reproductive health. We don't do it openly. So we don't talk about it openly. Even though we might know that there could be some links to what's happening, a vaginal area or uterus or, but because we are taught not to talk about it, we don't talk about it. And we don't say these things out loud because it's considered taboo or dirty, or I may be, considered as some other type of, person if I talk about that openly. But when we don't present everything in that connected way, then there's no way for the medical profession to actually, get to the bottom of maybe what's happening. Or if that person is not trained, then what questions do they ask? They will just stop it at, all right, you got bones that are sore, we'll give you this medication, right? And then next thing you know, it's going to be something else. You might have a UTI, and you'll just be treated for the UTI. Whereas when we are educated about the kinds of symptoms women could go through at a particular age period, then we then have the power ourselves to speak up about it. And if we have family members around, men included, if they are aware of what could be happening, then they could be, helping, get the woman to, seek the right type of help, rather than call her she's bimar and, say she's resting, or she can't be doing anything else because she's sick. She's not sick, she just needs to have the right hormones working in her body again so that she does have that energy and, that ability to carry on, whatever she wants to do. It's knowing about what's happening, but knowing about it in the correct way. We've talked about women's health seeking behavior. Women who will, take traditional herbal medicines and go to prayer meetings and all of these things, whilst at the same time, significantly suffering from, reproductive health issues, including the symptoms of or manifestations of menopause, perimenopause, and it just can lead to very dire consequences. Aside from the health implications, we have seen, or heard of stories of women who have left their jobs abruptly, because, one, they can't cope with their work, and two, the employers don't understand what's happening. And, right at the prime of their employment, their careers, making moves like that, and suddenly after a while realizing, that was happening at that time, why did I quit my job, because there is no support services. People don't understand what happens to women only because we don't verbalize what's happening to us. And I would encourage more women to talk about this, even in their peers.
Absolutely.
And then seek out the help that they could be getting from the professional service providers.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
Oh my gosh! Oh, what's in the box?
You're probably wondering, what's in the box? Well, if you must know, it's actually me. Before you call the police, I'm actually an app. The all-new Fiji Village app. Here's an update. See what I did there? I gave you an update. What's new? Well, for starters, I look different. My new layout also comes with stories if you're looking for something short and sweet. I will bring you the latest news on the dot so you stay updated. You're welcome. You don't have to go anywhere for content because I bring the content to you. Not only can you listen to your favorite radio stations, you can also watch online video content. Which reminds me, do you love sports? Well, guess what? With the Fiji Village app, you can stay up to date with your favorite sports and scoreboards, no matter where you are. Your #1 news website just got better with an app. Download and get updated now.
Welcome back. You're watching Fiji Village Street Talk. I'm Vijay Narayan. Our topic tonight is menopause, and our guests are Executive Director of Fiji Women's Rights Movement, Nalini Singh, and Dr. Rachel Pillay. She is the Head of Family Health at the Ministry of Health. According to research, every woman goes through menopause, and the symptoms normally start in the mid-40s. You could have it much earlier, as Dr. Rachel said, and you could have a bit later as well. But majority of the people go through these phases, knowing that we have 70% of our population below the age of 40 years, and soon we will have more women going into mid-40s. We need to address the issue of menopause. What should be done now, Dr. Rachel?
Thanks, Vijay. That's a very important, pertinent question as well, because, what should we do now? I think firstly, from the health perspectives, what we need to do now is, and what we will be doing is, we definitely need to develop some appropriate guidelines, training materials for our staff on the ground. Because like Nalini mentioned, if you can't clump the signs, symptoms together, you don't recognize it, you don't respond. That's just normal response of any healthcare worker. You don't recognize, you don't respond. But rather what happens is we're treating individuals for the symptoms that they present with. If they present with anemia, of course, I'll find out what the reason for the anemia is. But there could be more to it. What's the age group the woman's facing? So all these things are very necessary, important capacity building for every individual healthcare worker out there. And once we've done this, obviously capacity building on the ground, we need to ramp up and break the silence further, we were just talking about it, and it's so important that even to the point that, a woman sharing with another woman immediately just close to them, there's so much shyness to talk about sexual reproductive health out there. We shy out to talk about it. For us who've been talking in this space, we talk quite openly. But there's a lot of people out there who, even in an office space, will feel very uncomfortable talking about these things, sharing with other peers. So breaking that silence, creating that communication, adding that knowledge base to individuals, and helping them recognize. And then after that, obviously, one of the important things we really need to do is making sure these women that really need help make it to the health facility. And right now, immediately as we speak, we are doing something. Not that there's nothing happening in the ministry, but it's very centralized. For example, if our public health team would see, for example, the Women's Wellness Center near CWM, if they see any women going through these menopausal symptoms, they'll refer them immediately to the gynecological ward in CWM Hospital. Same thing with Lotoka and Lambasa, etc. That referral mechanism would happen, and the gynae team would come in. This is from the public sector. And then from the private sector, obviously go through the same process and go through any necessary hormonal therapy, etc. So these are things that we really need to build up on. We need to educate our women, our women and men out there. I don't want to leave it to the women alone, because I must say men are important partners in this. So we need to educate our population in this, and strengthen this space. And honestly move forward with our response to addressing this aspect of wellness within our women.
I like that issue saying about the health workers to be updated on how they can deal with it better, because sometimes the woman may not know what they're going through, as Nalini pointed out. So in that case, the medical professional has to sort of make that assessment and not be ignorant about it as well. Now, what do you think needs to happen, knowing that our population now, 70% of our population under the age of 40, and eventually more women will be going into the mid-40s area?
Yes, this issue is going to, be at the forefront, as demographics of a country change, we are moving towards having an aging population, more of a aging population sooner. And, these issues should have been, discussed openly a long while ago. and in a way that's progressive and constructive. And so we haven't. I say this because this particular project that we did is part of monitoring of the International Conference on Population and Development's Program of Action, which focuses on sexual and reproductive health and rights. This, menstrual hygiene management is recognized as one of those issues under SRHR. It's been 30 years, Vijay, and not a lot of progress has happened in most of the areas under this program of action. And so with the 30th anniversary of a 20-year agenda, we decided to put our tiny bit of resources into, talking to women about menopause. And it's high time. It's high time we as a community and society stop pretending that sex and sexuality and reproductive health is something that is not to be discussed openly. We need to discuss it in order to make sure that everyone in our community and society has a healthy and, safe and, pleasant life. That we are not having half the population living in discomfort and pain and feeling not well, and not understanding what is happening. We cannot go through the next decade, where women are not talking about this, and suffering in silence. Gone are the days of not having responses from the medical science perspective, or the counseling services perspectives. We have a lot of services and medication developed. We need to now move away from considering all these issues as dirty, and start openly talking about this, so that we, as we age, have the services, can continue living a healthy, quite, active lives, and still contributing to, whichever ways to nation building, as well as ensuring that the next generation will have access to better services. Here, this research is only the foundational thing that has happened. We have scratched onto the surface of what has been silent, and we hope and encourage all different stakeholders, including your media organizations, to start talking about this and join us when we call out for, say, for example, better curriculum on family life education in school, because that's going to be a huge way forward in terms of educating everybody about what's happening in our bodies, and to have the understanding, respect, and the type of services we actually need. Women are neglected a lot. Women are not trusted a lot. And women, when they talk about their pain and the various manifestations of what's going in them, the first reactions are not very accepting and understanding. And that's when they clamp up. But time has moved on. And we need to be looking at, what is out there and what could be made better for us. And we are seeing more of an opening of an understanding of what happens to women. And so this is the time that, we start exploring that and encouraging everyone to not suffer in silence, but reach out and start asking, well, why can't I have hormone therapy? Why is it so expensive? Why do I have to go overseas for a certain treatment? And why doesn't our government provide certain things, that could alleviate a lot of the symptoms that we actually experience?
Dr. Rachel, the hormone levels we talked earlier change during menopause, most significantly estrogen, which controls the menstrual cycle and contributes to a number of other bodily processes. A BBC Health report states that as women age, the ovaries produce fewer eggs, estrogen levels fluctuate, and then gradually reduce, and this leads to menopausal symptoms. With these significant changes, we have personally heard of stories of women not being understood by their own families, and women just expected to accept all of this as part of being a woman. How do you tackle this issue, knowing that in reality this is happening, but people are saying, oh, this is just part of being a woman?
That's absolutely. I mean, how do we tackle this issue? I think, well, firstly is awareness. The understanding by the families is so essential. And then from the health perspective, like we mentioned, recognizing what's happening to the women and responding to it. And the other thing is, firstly, the woman herself recognizing and responding to something. And this is where an important aspect for health comes in. And I must say, this is something that in our culture becomes a bit of a problematic issue, that our health-seeking behavior becomes very poor. If we're sick, like in the sense if we've got coughing or any illnesses, fevers, etc., our health-seeking behavior becomes quite, it's not as good as we'd want it to be in Fiji. And one of the important things is, if this comes up in a family, health-seeking behavior is so essential, because what happens at the end of the day, you seek health services early, you respond to it early, you're able to normalize things in life, and your productivity in life goes up in all aspects, family matters, economically, health-wise, in all aspects of life. So I think it's so essential that we look into this context and empower women to turn up. I think that empowerment needs to happen at home and in the workplace, out in the community. I think I'll probably stick to that, breaking the silence and talking about it. And not just that, but making a stand and coming forth and doing something about it, responding to it. Because like I said, you may face like the number of things, there's a lot of signs and symptoms that follow through. And you may think and associate it to something else. You literally could do that, because there are similar signs and symptoms for other diseases, other issues that people face through. For example, even just stress at work could cause headaches, etc. But constant, or something that's very constant over a period of time, there's something to look into it. There's always a reason why something happens in our body. Our body responds in that way. So recognizing that is important, not for the women alone, but also for the healthcare worker. Again, I'll go back to capacity. Having that capacity on the ground to be able to respond is essential, and recognizing. So when it comes to that, we need to be able to ask the right questions. And I must say that's one of the things we're literally moving towards, is having that in our standard operating procedures. When any woman walks through our doors, especially through our maternal child health clinics, I'm going to ask you these few questions, and if you're all good, that's good. But next time around, we can always come back, and obviously creating this awareness. So
how quickly will that procedure be implemented?
I must say it's very opportune right now, because why I say that is we've for the first time in Fiji, we've just endorsed our maternal child health policy. Now, if you look at the maternal child health policy, it's a policy which works in the maternal child health clinics. Every parent that has taken their child to a child health clinic, that clinic is actually called an MCH clinic, a maternal child health clinic. But one of the things that's happened predominantly is we focus so much on the child. You ask the women, have you been asked any questions around this? And you'll probably see no. But in actual fact, the reality on the ground is that MCH clinic, it's an MCH clinic. Now we're standardizing it right across the nation through this policy, and we've developed standard operating procedures around it. We're going into pilot phase, but we're also going to make sure that these SOPs have these few questions on board for our women, because we're not just seeing women, that just come in with their children, but we can even see others as well. So in this context, we're making sure we ask them the right question, educate them in this context, go through all the other services that we can for cervical cancer, family planning, etc., HIV, sexual reproductive health space. And so why I say that is because it's opportune. We've got this policy now coming about, and that standard operating procedure is a working document, and we'll build up on that. And we're already started training. we will definitely make it a part of Rollout, and we definitely hit the ground running. So you can anticipate these things to happen this year. But having said that, we've got to be mindful. The Ministry of Health is huge. We've got thousands of healthcare workers who respond in the primary healthcare space. So getting out there, but again, internal communications for us, external communications as well, having the right instruments to collect data, be able to respond to things, to be able to train. This was something that's a process. So, but you can anticipate that from the standard operating procedure context, it can happen almost tomorrow, and we're working on that. We've got a technical working group on this that is looking at the MCH policy and the rollout of the pilot. So definitely we'll take it back to the team, and we'll develop these guidelines. And if we need any expert opinion, I think we've talked about it at the recent launch where we have got UN Women, we've got other organizations, etc., that UNFPA and the others that can come on board and help us expedite this process for sure. At least recognizing and responding is what we really want to move towards immediately, and necessary referrals while we build up the ground levels.
Looking forward to that urgent action that the Ministry of Health will be taking. Nalini, many women, as we've said, have been suffering in silence, with family members not understanding what the women are going through, many even ending up getting ridiculed or attacked, leading to issues like gender-based violence. We've got a very high rate of gender-based violence in this country, and questions need to be asked: how many of these are related to menopause, because the men do not understand what the women are going through? What needs to change in this country in relation to this issue?
Very interesting. I don't know, my initial thoughts around that particular question around, so how much of the violence against women is attributable to what women are facing during menopause. I stay away from that type of analysis, because I don't want women to be blamed. It's very easy in a patriarchal society for that particular type of statistics to be twisted, and women would be blamed even more for bringing on the violence onto themselves. I would, rather than focus on trying to understand why women would behave in a certain way while experiencing, perimenopause, men in menopause, because you are right, they do face violence, and in different forms. One of the manifestations during this period is a lack of libido, and sometimes women don't want any intimacy with their intimate partners. And, usually the men would turn around and accuse the women of having affairs, extramarital affairs. And, whether that actually causes, violence, I don't have the statistic around it, but still, women, find that astounding, that, why would that accusation be coming up at a time when, they are not feeling the best and very vulnerable, and, out comes the accusations without understanding of, what they're going through. And you're right, there could be even more violence associated with this, because you got to remember, women do 70 to 80% of the unpaid care work in the families and in the communities. And what happens, during the time when they can't contribute that much, and so there is that expectation of that women will continue to contribute so much time towards unpaid care work, but it's not possible. That too creates tensions. Who's going to be looking after the children or the grandchildren, or events that are happening in the communities. And a lot of this is attributable, again, to the fact that, the women don't talk about what's happening, and they don't get medical advice around, what could be done to alleviate some of the symptoms. And, of course, then lack of understanding by their partners. in terms of how they can be more supportive, at home. So a lot of education is required. Not everybody likes to read reports and books, but they, like I said, if we had this type of information processed through the education system, then everyone would be aware at an earlier age, knowing fully well what's going to happen later, and know how to react and know how to behave with family members who are experiencing this process in their bodies and in their lives. Because look, they're not sick, women are not sick. They're experiencing different manifestations of the hormonal changes that are happening, and they need help. They do need help, and sometimes that could be from counseling all the way down to some maybe medical interventions. But we have to know where to go to, who is going to be the right person to provide that, so that we don't get entrenched in further harm, because there's in yesterday's conversation at the launch, last week's launch, it was the conversation turned to suicide. So what are there cases where women are committing suicide because of this? Not knowing what's happening to them, not being able to talk about it, not having the services, what happens to them, and all the societal attitudes that come along with it. So we don't have a response to that. We don't have the statistics, but as we dig and scrape through the issues more, I'm sure we will be coming up with a lot more that is happening to women than what we have found. So 66 symptoms or 66 things that could be happening to the body, but the implications of that could be a lot more, in terms of well-being and how do we live our lives and how are we accepted in society. Sometimes women are considered mad or declared mad, because they become a little irrational, a bit too emotional. But that's what hormones do, So what kind of support is needed there? It's not a tricky issue if you can talk about it and have an understanding. But this, in an issue by itself, is one that is under a lot of study now. And that's because women all over the world have decided that we're not going to suffer in silence. It's about time. And that's why in a world where medical science is dominated a lot by what happens to men and how they react to certain conditions and ailments, I think the women are deciding not around this one. We're going to talk about it and, let's see then what kind of interventions would be needed. It could be holistic medicine to lifestyle change to counseling or hormone replacement therapies. And, I'm waiting for the day for women entrepreneurs to come up with cheaper versions of hormones that, can be available to more women in a cheaper way, because right now it's absolutely very expensive. You have to be very resourceful. Insurance doesn't cover it, so you have to have resources to actually go through and have the benefits of.
Well, that's something else that the insurance companies need to look at as well.
Newer versions of hormones. Otherwise, you're stuck with the old ones, and they might not be effective.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
Oh my gosh! Oh, what's in the box?
You're probably wondering, what's in the box? Well, if you must know, it's actually me. Before you call the police, I'm actually an app. The all-new Fiji Village app. Here's an update. See what I did there? I gave you an update. What's new? Well, for starters, I look different. My new layout also comes with stories if you're looking for something short and sweet. I will bring you the latest news on the dot so you stay updated. You're welcome. You don't have to go anywhere for content because I bring the content to you. Not only can you listen to your favorite radio stations, you can also watch online video content. Which reminds me, do you love sports? Well, guess what? With the Fiji Village app, you can stay up to date with your favorite sports and scoreboards, no matter where you are. Your #1 news website just got better with an app. Download and get updated now.
You're watching Fiji Village Straight Talk. I'm Vijay. Narayan, our guest tonight, Executive Director of Fiji Women's Rights Movement, Nalini Singh, and Ministry of Health, Head of Family Health, Dr. Rachel Pillay. We are talking about the issue after the report coming out regarding the M word, and the silence about menopause and what Fijian women are going through based on the report, and what we as a country should be doing about this critical issue. It is about time to talk about perimenopause, menopause and post-menopause and how it affects the women in this country. The FWRM report has highlighted that 80% of the women in Fiji strongly agree that increasing awareness on menopause can help women understand the menopause process, gain more knowledge, and learn how, where, and when to seek help. How can this be done, Dr. Rachel?
Thanks, Vijay. That's definitely important. And with the silence on the ground, how can this be done? Oh, wow. It's a big task ahead of us. Literally a big task ahead of all of us is, again, breaking the silence and getting this communication out there. And from, like I mentioned, from our perspectives, we definitely need to up our game, our communication internally, externally. That's something that definitely we're working on, and getting a lot more communications. And one of the things we always would love and appreciate is that collaboration that we have with our NGO partners, because our NGO partners like FWRM, FWCC, MSP, REF, and a lot of different organizations that work in the space of SRHR, they become very important collaborative partners for us in this. And as we speak right now, like MSP, REF, they're already doing a lot of awareness on the ground. A lot of one-to-one, a lot of group community discussions. We need the faith-based organizations with us on this from this context. We need our media organizations with this. I mean, we rope in our media organizations to talk about other health issues. This is another health context from the wellness perspective, that from the womb to tomb perspective, that we really need the media to talk about as well. If we can talk about the sick, why can't we talk about the normal processes of life as well? So I think it's a whole of society, whole of government, and literally everyone's responsibility to start talking about it, while from the health perspective we respond to things. So creating that awareness across society will be very essential. And like I said, I think the key word for us today is just literally breaking the silence.
Having national campaigns, and also is what Nalini has said about looking at the curriculum, a big change through the government system as well, and Ministry of Women, Ministry of Education, Ministry of Health, and every other ministry working together as well. Nalini, healthcare concerns have been raised. How can women who have perimenopause, menopause or post-menopause seek help from your perspective on the ground? As health professionals need to understand issues like the type of help, advice, counseling and support that is being needed, as highlighted by Dr. Rachel. We've heard of some male doctors practically telling women again that menopause is just part of being a woman, and no treatment is provided after that. This issue keeps coming up, and this is something we have heard from the ground, that this is just part of being a woman. From your perspective, speaking from the people on the ground and the surveys done, what needs to be happening in terms of the type of help, advice, counseling and support, so that the women know this is where I need to go, this is how I'll get her help?
Yeah, I mean, of course, it is what women go through, so that's true, but that doesn't need to be dismissed at that point, because, I mean, no one is expected to live their lives in discomfort and in pain. Everybody is trying to be in the best of health. Nobody likes to be feeling sick or ill or not 100%, in any which way. And so, the first would be, we do need protocols, and how and what questions to ask to confirm what is happening. So that's one. I agree. We need to have the protocols developed. We need to have the healthcare providers to be trained, so that not just to identify symptoms and be able to prescribe, medication or whatever, but also to provide their service with the sensitivity and the care that is needed. Because often, women, if you ask them, if they're in facing violence, they'll say they just want the violence to stop. Also when they're not feeling well around any of these issues that we talked about, the 66 symptoms and more, they would just want that to stop, so that they can continue. So how does that happen? One, it happens when someone who's at the receiving end of listening to, well, this is my concern, and I'm, yesterday I had severe, aches and pains on my left leg, and, today is somewhere else. Then for that person to have the sympathetic ear to ask the right questions, look at the kind of statistics and look at the profile of the patient, to try and build an understanding of why, could the random series of, symptoms be presenting to this particular woman, and not be dismissive. I mean, so for all of this, there is, a lot of training that is needed because, as Dr. Rachel said, we have a healthcare system that is driven towards illness prevention or diagnosing illness and getting people to recover from that. But it is not looking at I guess the whole point of wellness and well-being holistically, so we do need to have appropriate training around that. And women to be taken seriously when they do approach healthcare providers, and to then have a better sort of pathways to manage what they're experiencing, because from perimenopause to post, there could be a wide range of symptoms that could be experienced, and it could be very different. And so not to be dismissive and acting in a fed up manner, but writing this down to build a profile of what's actually happening, so that the right medications or hormone treatments, whatever that is required, could be done. At the same time, also we need to have appropriate psychosocial support as well. So that if someone decides to, utilize that service, then the person who is at the receiving end of the call knows what to ask and what kinds of, options can they provide. We must know the referral pathways in here. I mean, we have a wellness center here in Suva. We must know where else we have that in the rest of the country, so that, when we develop the pathways of referrals, we know exactly where they are. The organizations are wonderful partners that work on the ground with communities. They need to be equipped with the right information and knowledge, so that as part of their ongoing training, they can bring this aspect, in, so that it becomes normal conversation. We heard some of our partners, at the launch who spoke about, they're going to start incorporating this issue. All we had to say was, that's great. Do it in a way that it's understood with the same sensitivity. Don't have the doors closed on the word again. So, there's a lot more, I think, that needs to be tweaked and made right. And we have many partners who are willing to go to the ground. And even right after the launch, we started, receiving requests from faith-based organizations saying, can you come to our churches and start, talking about this issue? So, yes, that should happen. But who's the right person to speak about this issue? Is it a women's rights organization, or is it someone that who knows a little bit more about this issue and can speak about the facts in a particular way, or should it be a combination of both? So it has to be done in a way that is going to be accepted and done in within all the sensitivities of the community, because the issues we are talking about are still not considered open yet. So.
But a lot has to be done, and we need to start taking those steps, as we've said, and hopefully those steps will be taken in the near future. Hormone replacement therapy is something that some women need, and of course that is something that has been brought to light also about the cost of it, that women should not be in a situation where it's unequal treatment being provided, because the haves can have the treatment and the have-nots continue to suffer in silence. Will this be something that we look at as well?
Yeah, definitely. I mean, this is something that will become part of the larger guideline, Vijay, because when you look at it, we can't provide, it's unethical literally to provide an advocacy and be able to approach and open up that opportunity for menopause respond and not be able to provide the treatment at the same time. So, and we will definitely have to go through guideline developments. We've got to go through our processes. We'll be doing that, and it'll be a consultative process across the ministry, across our partners. So that is something definitely we'll be looking at. And for health, anything, obviously, health has that holistic approach, from recognizing to responding, and that responding also includes treatment. And we will definitely explore all opportunities and in this context. So yeah, definitely.
Good timing, because the budget is about to, budget submissions are being made. Now, the brain, periods, skin, muscles and emotions are all affected by falling levels of estrogen. Falling estrogen production can also have a long-term effect on the bones and the heart. Many women have been affected by those things, not directly by menopause, but there's other things where then they suffer for the rest of their lives. Women can have some, all, or none of the common symptoms, and for varied lengths of time. What is your message for both of you to women and the general public on this issue, knowing that there are different factors at play when we're talking about menopause?
Yes, so the main message from our side is, for women to open up and recognize what they're going through as part of their life cycle. We go through the menstruation cycle, and it has an ending with menopause. We know the reproductive age is between 15 to up to about 49 or so, and there within towards the end, the body does react in very different ways, and hormone production, of course, then sort of varies between individuals, and that manifests in a whole lot of symptoms. We should be able to talk about it. We shouldn't pretend that we can cope with the pain and everything else that happens, as Vijay said, from our skin to bones to brain, every part of our body is affected. And we must recognize that. We should be able to talk about it, if with nobody, then at least with our medical practitioners, and insist on better care. And whilst we wait and work with Ministry of Health for the protocols and the trainings and all of that, on the ground, we must start, stop the stigma around this issue, because women are not sick, as in the way we describe it. Women are going through a process. We need understanding, we need the care, and we need the support from everyone, so that we can still be, productive members of society, and we can live our lives in a fulfilled way. So for that, women first need to, be bold enough to speak about their issues, And we then expect the community of support to be rallying around her because we make up 50% of the country, and we cannot have 50% of the country living in discomfort.
Dr. Rachel, what is your message to the women and the general public on the issue of what we talked about, the brain, period, skin, muscles and emotions? Falling estrogen production can also have long-term effects on bones and heart. All these issues will end up at the hospital, but at the early stages of perimenopause, when these things start, what is available for the women anywhere that they're watching from around the country? Where can they go and where can they get some sort of advice, counseling, support and help?
Thanks, Vijay. Definitely. I mean, a message to the women out there and men as well at the same time is, because there's certain things. First, recognizing the signs and symptoms of menopause. And especially if you're at that age, if you're hitting the 40s, into your 50s, recognize these things, recognize the changes, and try and pay more attention to these signs and symptoms. Like, for example, during your irregular periods, your vaginal dryness, for example, just that decrease in sexual desire, brain fogs, etc., fatigue, anemia, or bleeding issues, even headaches, muscle pains, etc. Basically, there's a lot of signs and symptoms around it. But if you recognize that at this age you're facing some of these, please respond to it and go to the nearest health facility. And from there, they know with that conversation with a healthcare worker, they can immediately make a referral to at least the gynecological team to respond and help you in this context. And one of the most important things, Vijay, I just wanted to let also just out there is, with menopause coming about, the risk to women increases, especially for cardiac issues. And a small fall can make a difference. A small fall can bring about a fracture, which in a premenopausal stage where everything's normally hormonal's okay, it wouldn't. So being careful even in your day-to-day living your life and you respond at these particular ages. And also, most importantly, for women out there at this particular age, 50 above, going back to and getting those vitamins and minerals that you literally need for your body, those replacement immediate that you can do, which is definitely just off the shelf counter that says 50 plus, etc. These are very important for women and obviously men out there as well, but specifically I'm saying this out to women because of the process of menopause that individuals go through. So firstly, and obvious most important thing is break the silence, recognize it and respond to it, and go to your nearest health facility to talk about it and get the necessary referrals you can to the gynecological team across the nation. Thank you, Vijay. I think I'll leave that.
So we can see the new report states urgent action is needed to assist our women regarding menopause. Societal barriers, taboos and insufficient education on menopause are huge challenges for us at the moment. We need the government support immediately. We need the support of the NGOs. Some NGOs have not been talking about this at all, civil society. We need to get out there and ensure that there's more information that's out there in the public. The media, no doubt, needs to do more of what is happening right now so that it becomes a national campaign together with government and together with the civil society organizations and the family support. The critical issue about the family and how they can understand better the suggestions in the report made and as highlighted by Nalini and Dr. Rachel tonight on the importance of having it in our curriculum as well for people to understand. Before we finish the show tonight, your final comments, Dr. Rachel.
Thanks, Vijay. I think the final comment I'll leave is break the silence. Let's break the silence. Let's talk about it. Definitely from our side, we'll definitely step up, recognizing, responding. But it also means that people have a healthy seeking behavior to respond to it as well. A health seeking behavior is essential in Fiji to be able to respond appropriately.
Nalini?
Thanks, Vijay. I think from our side, having broken the silence on the M word, we certainly hope for more organizations to join in the effort and one, to amplify the message that's in the research. Two is to see where you can contribute. You know, if you're an organization that has large community outreach and you can reach out to women and men and talk about these issues, then do reach out, because we can share information or connections with those organizations that have expertise. And 3 is, let's please join us in our advocacy efforts for, when we call for, better curriculum in schools, family life education, please join us, because it's not just our responsibility to be calling for better curriculum. It needs to be everyone, because as opposed to common thinking about what comprehensive sexuality education is, it does contain all of these issues that we don't talk about, which mean so much to us. So, we hope that, our media partnership and everyone else that can talk about this issue picks this up, because we don't want any of our women to be suffering in silence.
Thank you, Nalini and Dr. Rachel, for speaking to our viewers and listeners this evening on Fiji Village Straight Talk, on our live channels on Facebook, Instagram, on X, and on TikTok, and also on our podcast, Fiji Village Straight Talk with Vijay Narayan. Until next week, you have a great evening.